Hello everyone, and welcome back to MediInsights, where we unlock the wonders of wellness. Today we explain Baloxavir marboxil tablet, a single-dose antiviral for early influenza. Learn what it treats, how to take it, how it works, the side effects to watch for, and clear practical advice in just 2 minutes. Let's go over the main reasons doctors prescribe Baloxavir. Baloxavir marboxil is used to treat acute, uncomplicated influenza A and B when started early after symptom onset. You can receive it if you're 5 years or older and have been symptomatic for no more than 48 hours. It is also approved for post-exposure prevention in eligible patients. Now we'll explain the recommended dose and schedule. The medicine is given as a single oral dose based on body weight. For people who can swallow tablets, the usual dosing is one 40 mg tablet for patients under 80 kg and one 80 mg tablet for patients 80 kg or over, and pediatric dosing uses an oral suspension or weight-based calculation for lighter children. Always follow your prescriber's dose instruction exactly. A quick note on how Baloxavir marboxil works at a basic level. Baloxavir marboxil is a prodrug that is converted to the active drug Baloxavir. The active form blocks the influenza virus cap-dependent endonuclease, which prevents viral mRNA synthesis and stops the virus from replicating efficiently. This novel mechanism differs from neuraminidase inhibitors and helps reduce viral load after a single dose. It may cause reactions in some users. Here's what to expect. The most commonly reported side effects in adults and adolescents include diarrhea, bronchitis, nausea, sinusitis, and headache, and in younger children, vomiting and diarrhea are more frequent. Serious allergic reactions are rare, but require immediate medical attention if you experience hives, swelling, or breathing difficulty. Report any worrying symptoms to your healthcare provider. Last but not least, important advice for safe use. Take the single dose as soon as possible and within 48 hours of symptom start for best effect, and follow your prescriber's instructions. Avoid taking it at the same time as dairy products, calcium-fortified beverages, antacids, laxatives, or oral supplements that contain polyvalent cations such as calcium, iron, magnesium, selenium, or zinc, because these can lower drug absorption. Baloxavir does not replace influenza vaccination, and you should tell your provider if you're pregnant, breastfeeding, or taking other medications. Thanks for watching. If this helped you, please subscribe to MediInsights and hit the bell to get future updates. Leave a question or your experiences with antiviral treatment in the comments below, and we'll reply as soon as possible today.